Hi, my name is Holly Weyl, and I'm going to present my project, Increasing Colorectal Cancer Screening Through Interprofessional Collaboration with the Nurse Navigator. Colorectal cancer is a huge problem. It's the third most commonly diagnosed cancer and the third leading cause of cancer death among both men and women in the United States. Although the incidence and mortality rates are that high, it is a disease that can be prevented and treated if caught in an early stage. That's why screening is so important. Nurse practitioners are in roles that make them responsible to educate and to encourage the patients to obtain the recommended screening. The purpose of my project was to present the evidence from a literature review to the providers and staff at the Baptist Family Medicine Group. The evidence-based practice change that I proposed was for the primary care office to refer patients that were not up to date with their colorectal cancer screening to the GI nurse navigator at Baptist Health Lexington. The nurse navigator can provide education, answer questions, and help the patients to overcome the barriers that they present when they're scheduling a colonoscopy. Also, the nurse navigator can help identify problems with the process of scheduling the colonoscopy so that patients can be scheduled in a sufficient time frame. One thing that we notice is that when patients, if you can't get them scheduled quickly, and you put it off for a month or two, they tend to find a reason not to get screened. So we like to go ahead and get it screened while they're willing to do it. And the literature review that I conducted included 6 randomized control trials, 1 cross-sectional survey, 1 qualitative study, and 1 quasi-experiment. The studies in the literature review were very valuable to nursing practice in identifying different strategies to increasing colorectal cancer screening. A few of the randomized controlled trials included some that looked at tailored interventions, mailed interventions, video-based interventions, physician reminders, and even navigation programs. Primary care providers build a trusting relationship with their patients, making them more willing to obtain screening that is recommended to them. And a priority needs to be focused on the patient adherence to colorectal cancer screening. The evidence supporting the practice change was presented to the Baptist Family Medicine Group at a monthly physician meeting. The presentation involved 5 physicians, a nurse practitioner, and the office manager. The group was very attentive and asked appropriate questions throughout the presentation. It was very informal, which made for good discussion. The strengths of my project is that I did present it during this physician staff meeting. They were able to fully participate and there was no interruptions or distractions to them. One thing that I found is that it would have been more effective if I had the exact number of patients in their practice that were not up to date on their screening. They were asking questions like, how many of our patients do we recommend for screening, but then they never get scheduled? They weren't aware of that data, and I think that would have been more beneficial for them to know that. Another thing that I noticed is in the step 4 of the Johns Hopkins evidence-based practice model, it talked about developing an interdisciplinary team. The thing that made my project a little bit difficult is that I had a couple different groups of key stakeholders. I had the physicians and the office manager in the primary care office, but then I also had the nurse navigator and her director. Initially, my project was going to have the nurse navigator to schedule the colonoscopies. That way, she would be able to identify any of the barriers, overcome them, and get it scheduled at that time. But after discussing this with her director, she felt that it might be better for the nurse navigator just to assist and identify problems in the scheduling process, but not to take on that responsibility at this time. Overall, they were very involved in the discussion, and I think they're likely to implement a change utilizing the nurse navigator and developing a process to increase the colorectal cancer screening rates with the help of the nurse navigator. Thank you.